Okay, go ahead, Christy.
Good evening, everyone. I'm Christy Starr from Easterseals Family Support Services, and we wanted to thank everybody for joining us. And I'm going to turn this over to Abby from Family Matters.
Hi, everybody, and welcome to our presentation today. We are still having a lot of people filtered in, and I'm putting some pretty important information in the chat box. So if you could please keep an eye out for that as it comes through. So the contents of today's presentation are funded partially from the U.S. Department of Education. Um, I want you to understand that we are partially funded from U.S. Department of Ed, but we don't represent the policies from the U.S. Department of Education, and you should not consider any type of government or federal endorsement from the U.S. Department of Education. Family Matters is, of course, not a legal service agency, and we cannot provide you with legal advice or representation in any way. Information received from Family Matters is not intended as legal advice and should not be used as a substitution for legal services. Family Matters PTI is one of the two parent training and information centers that serves the state of Illinois. Family Resource Centers on Disabilities serves the metropolitan Chicago area, and Family Matters PTIC serves the other 94 counties in the state. So there is a poll question going around about how much you know about your PTIs. Please remember we have two. You can answer questions related to PTIs about either parent center, but we just want to know more from you as a whole. Do you understand what your PTIs do for your family and how we can help serve you? My name is Abby Mars. I am an educational support coach and Charting the Life course ambassador here at Family Matters PTIC. I am also a parent of four children, one of which who is turning 22 next week. I cannot even face this, but 22 next week. And he has a significant developmental disability and autism. So, when I explain some resources to you, when I share some stories, they come from a parent's approach as well as a professional approach. So, I've navigated a lot of these paths that I'll be talking about today. If you'd like access to the slides from today's presentation, there is a link in the chat box, or you can follow the QR code. There's also some great other resources in that shared Google Drive. So let's talk a little bit about what we're going to learn about today. We will be having questions at the end. We will, if you have questions while we're going through and don't want to lose track of those questions, please utilize the Q&A box. I would like to remind everybody that Family Matters does not offer CEU credits. We can offer you a certificate of completion after today's presentation if you so need one. Again, put your questions in the Q&A box so we don't lose them. But at this time, at this particular moment, I want you to utilize that chat box, and I want you to tell us where you're from and what your role is in your student's life. Are you a professional, a caregiver, a parent? Are you yourself a self advocate or student? Please let us know that in the chat box. So, where you're from, meaning like county in Illinois, or if you're from outside Illinois, and again, what your role with your student is. If you could please utilize that in the chat. So, today we're going to identify two key strategies to teach youth with developmental disabilities about puberty. We're going to describe two puberty-related changes and explain them clearly, and access at least two trusted resources, and of course promote healthy body image, privacy, and hygiene practices. When will puberty begin? Right? So puberty, of course. Oh, we got one from South Dakota. Thank you. Thank you so much, South Dakota. So puberty typically, and I like the word typically. I don't like the word normally because normal is a drier setting. We should all say that together as we're setting here. Normal is a drier setting, not a way to describe someone. So typically, puberty begins between the ages of 9 to 14. So as your student, as your child, as your dependent approaches the age of 9 years old, this is when we start to look for signs of puberty. But it varies with every child. Some youth may start earlier or later, and that's okay. For neurodivergent youth or those with developmental disabilities, puberty often begins around the same age as their peers, but they may need extra support to understand what's happening and how to care for those changes. So, as a parent of a neurodivergent individual and a child that had significant disabilities, and we tried lots of different medications to address our seizure disorders, that really affected when puberty hit for him. So again, there may be a medical component to your child's age at what they hit puberty as well. As long as we're seeing it somewhere between those ages of 9 to 14, I think this is, relatively the right path to go on. If you're not seeing changes by age 14, you may consider having a conversation with your medical provider. So puberty typically begins around this time. For youth with disabilities, timings may vary, as I said before, but the process remains biologically the same. Emotional readiness may not align with physical changes as well. Okay. Now, in this training, I use a very, very point of view terminology. Okay. I think for this training to be effective, for a caregiver, a professional, or self advocate watching this training, I have to be comfortable with teaching the topic. And I am very comfortable with teaching that topic. That's the approach that I was given as a youth from my parents, and it's the approach I've done with my parenting style. So I use exact terminology. I don't and you'll hear me express that and urge you to do that number of times throughout here. There's also images in here, all illustrations of the anatomically correct human body. So those will be be throughout the presentation. So we base this off of Tanner's 5 stages. So stage 1, there may be no visible signs yet, but the hormones are beginning to shift. The stage 2, first signs of physical change. So it might be breast buds in girls, or some of our young men might also start to show some fullerness in the chest. Testicle growth in boys, and body odor begins. That's usually the biggest key factor. You walk through your house and you're like, oh my gosh in heaven, what is that smell? Right? That's the sure sign it's coming. Growth spurts, and more noticeable changes like body acne. For us, growth spurts started seizures. That's not the same for everybody, but it can happen. Growth spurts can also offer some behavioral changes or emotional changes in our youth. So at stage 4, we see an ongoing development of the genitals, breast, and hair growth. And by stage 5, we're in full physical maturity. It is reached. Knowing these signs can help families and educators prepare for what's next and respond supportively. So if we start to see that your student has some hair growth, and that's the first sign you've seen of puberty, that doesn't necessarily mean they skipped the first two. It doesn't necessarily mean something's wrong. It just means this is your first visible sign that you're seeing, and you may need to take a step back. Okay, he's got some hair growth under his arms. I haven't really smelled body odor, but it could be coming. Maybe we should start those hygiene practices. So any signs of puberty in these areas that you start to see, that's when we start these practices, right? You'll notice every slide here has a citation with a link to something on there. There's more information that you can find about the topic on those little hyperlinks down there. So again, signs of puberty in boys. We're going to see some growth spurts, acne, hair growth, either under the arms, in the genital areas, or the face or the chest. Now, this can be different for each type of person because everybody has different genetic makeup, right? So you may not see facial hair growth on your youth until they're way older, into the puberty ages. You may see underarm hair first or genital hair first before you see one or the other. They do not have to go in this order. Their voice may change even for our non-speaking individuals. It's something I noticed with my son. He's a non-speaking person, and I noticed the tone of his voice was a lot deeper when he did make some sounds. Of course, the increase in body odor, the penis may grow in length or width. Nighttime ejaculation, and the testicles and the scrotum increase in size and become darker in color. So if you are a high support needs parent, like you do a lot of the hygiene for your student or for your child, you may help with bathing and things. These are things that you might see before. So now we're seeing these changes in our son, in our youth. What comes next? What should we do next? So these are just some physical signs that you might see with your youth. Same way with girls. So with girls, menstruation, of course, sometimes that happens before hair growth in the body. Again, I'm not a medical expert. I'm just bringing you some resources that we found. An increase in vaginal discharge, breast development, darkening of the areola, hair growth in the genitals and the legs, growth spurts for girls as well. Typically, we see those before boys start puberty. We'll notice, oh my gosh, my daughter's gotten really taller than the rest of her classmates. The increase in body odor, the acne in the skin changes, and increase in fat accumulation in the waist and the hips. So the important thing to remember, although our children may be developmentally delayed, or they may have different types of disabilities, their body is still responding as if it is a typical 14-year-old girl or a typical 14-year-old boy, or gender neutral 14-year-old person. So their bodies are still going to try to go through these changes. As I said before, it's important to remember language matters. We need to be direct and clear with our students, avoid euphemisms, and promote that puberty and sexuality are normal. It's very important to do that. There was a popular movie when I was in high school, and we all laughed and made jokes about the language that was used there, but it is very important to remember that we're going to use the exact terminology for our youth. One of the biggest challenges that caregivers face is figuring out how to talk to their youth about puberty. Here are key things to avoid. And here are key things to help. So be direct and avoid vague or confusing terms. Be comfortable with the word breast, vagina, penis, scrotum, masturbation. Be comfortable with those words. Say them out loud to yourself in the mirror until you get the giggles out, okay? But we got to be comfortable as the adult in this situation using these words. Use anatomically correct words and make sure that the youth that you're serving knows what those words are. So when you say, I need you to wash your penis, make sure you're saying that word. I started this at a very young age with my kids. I didn't wait till they're certain years of age to use these appropriate words. Um, and avoid euphemisms like down there or monthly visitor. They can be misleading for our youth. And also be mindful about how you talk about your own body. Okay, so model body positive language. This is really hard for some of us to do, but it's important when you're getting ready in the morning, you don't say, "Oh, I look like crap today," or "I'm fat today." Okay, we're not going to use those because our students really, really watch peer modeling. And I know you're not their peer, you're their parent, but they're watching everything you do. And if they hear you tell yourself that you're fat and they think that's okay, they may start to pick up on that. So we want to make sure that we're really remembering that language does matter. Emotional changes are going to happen. Okay. This could be mood swings, fatigue, anxiety, increased self consciousness, and body image changes. Think beyond the physical and prepare for the emotional changes that can be as disrupted as the body changes with your child. This is a sign for our son who is neurodivergent that we started to notice some aggressive behaviors. And I never would have thought puberty was the cause of that, right? And that's when our doctor said, "Well, puberty started. This is typical." So notice those things. If certain things that were helping before aren't helping any longer, and you're within that age range, maybe start to consider that puberty may be the what's at fault. Normalize all bodies. I was thrilled when the real Barbie came out with the she was actually the size of a human being. So as parents and caregivers, we play a vital role in how our children view their bodies. Youth with developmental disabilities often receive fewer messages about body acceptance, which can make them more vulnerable to poor self-esteem. It is important to normalize that all bodies grow, change, and look different during puberty. Also, using the anatomically correct, accurate language um, can help. This helps children communicate clearly and sets a strong foundation for understanding healthy safety and body autonomy. Of course, we're going to practice the language of puberty. So, one of the most effective tools we have is language modeling. Repetition and clear, simple explanations help make unfamiliar concepts more comfortable. You can even role play some common scenarios. For instance, pretend you're in the school nurse's office and your child needs to request a hygiene project. Make sure your child knows it's okay to ask questions and that asking for help is a sign of maturity, not weakness. By practicing early, we reduce the chance of confusion and embarrassment later. So we might create scripts and rehearse them with your child. For example, "I'm starting my period," or "I need help with deodorant." Practice using I statements. "I need privacy," or "I feel uncomfortable." Get those into your child's vocabulary, even if they're using a communication device, even if they are limited on their speaking abilities. Get comfortable with using these phrases with your kiddos. We're going to talk a little bit about building your support team. As a special needs parent, I know that it is vital that I have a village to help me out. A village is a loose term, of course. I don't have 500 people helping me, but I have my core people, right? So identify within those core people who you would feel safe, your youth expressing concerns about their body with. Make sure that those people that you have on your support team also have the same values and beliefs you do. If your family strongly does not believe in masturbation and someone on your support team does, think about that. Is it the message that you want to send to your student? Make sure the person on your team also understands your child's limitations and their developmental disability or their disability in general. Okay. Um, is it okay for Mike to be on here and we don't know a thing about how to help someone with autism? All right. You don't have to do this alone, nor should you try. Should you try? Building that support team gives access to safe adults who can answer questions, model positive behavior, and reinforce important messages. Your child's team might include the parent or guardian, teachers and aides, school nurses or social workers, healthcare providers, therapists, or mentors. Having conversations with your child about who they feel safe talking to, then speak with the team members to make sure everyone uses consistent, clear, and body positive messaging. Let your child know it's okay to talk to these trusted adults and ask these questions, especially about puberty. It's all a typical part of growing up. So definitely think about who can be on your team, on your student's team, kind of like an IEP team, a little bit different catered towards puberty. But it needs to be someone the student can identify going to and saying, I think I'm on my period, I need help. Or someone that your student can come to and say, I would like to have sex. What should I do? This has to be someone comfortable with, so if we have great great grandma on there that's not comfortable using this type of terminology, is she a good person to be on this team? Doesn't mean she doesn't love Johnny, doesn't mean she doesn't want to be part of Johnny's life, but is this a good fit for your team? So visual supports and books. I actually was laughing with Christy earlier. I took it upon myself to make a social story for us, and it's available in the shared guide and the shared Google Drive. So it's a template, and you can kind of fill it out yourself, and it's called My Puberty Book. A lot of these pictures you can cycle back out of here and change for yourself. You would, of course, make yourself a copy of this by going up here and doing the make a copy. But it goes through and it talks about my name is. It talks about changes my body might happen if you're a girl, if you're a boy, if you prefer gender neutral. It talks about their support team and their healthcare support team. Hygiene and the steps I need to do every morning, my swimsuit area and who can touch me in my swimsuit area, the feelings that I might be having right now, their puberty plan about what we should do every day, and of course our disclosure. So you can make a copy of this and with our shared Google Drive, and I urge you to do so. There are also lots of other great visuals that you can help with your student and help to prepare them for puberty, or if you're in the middle of puberty, help navigate that process. Visuals can make abstract ideas more concrete, especially for visual learners and individuals with intellectual or developmental disorders. Choosing visuals that are medically accurate and choose visuals that are medically accurate and body positive. Books are powerful tools to start conversations. Consider these inclusive and developmentally appropriate books, and there's a list of them in the shared guide. Make sure you as a parent look at them first. Is this something I can understand by reading this? Is this something that follows along with our family's culture and values? If the answer is yes, then use those. But you as a parent have to make that judgment first, and same way as a professional. If I present this curriculum to my students, is anybody's parent going to have a problem with this? Is this match their cultural beliefs? Remember that all questions are safe questions. It's crucial to create an environment where every question is welcome. This means responding with calm, openness, and reassurance, even if you're caught off guard. And it's, by the way, guys, it's absolutely okay to take a deep breath if you're caught off guard so you don't react inappropriately. If your kiddo happened to hear a clip from the Hangover movie and they want to ask questions about that, it's okay to breathe in your nose and out your mouth and say, we're going to talk about this in just a little bit, but remind me we're going to talk about this, or we're going to talk about this when we get home, and it's a more appropriate place to talk about it. Sometimes as parents, it's a little awkward when they start to ask these questions, and we might need a minute. But showing our students that we need a minute or we don't know the answer to that right away shows them it's okay to ask questions. So you may not always have that perfect answer, but it's okay to say, I'm not sure, but let's look this up together. The goal is to model curiosity and respectful dialogue. It's a topic, not it's a topic. The topic, if the topic is not appropriate for the moment, just ask your student if they can wait until it is a more appropriate time. Privacy and boundaries are big. So teach who they can talk to for safe adults, where these conversations are appropriate, and what to do if someone violates their boundary. Many individuals with developmental disabilities struggle with understanding abstract concepts like privacy. That's why we must teach these rules directly and consistently. Use simple, specific language. You can talk about private things like periods or erections with mom and dad, their nurse or the doctor, but not at the school lunch table. Or no one is allowed to touch your private parts except to help with care, and only when you say it's okay. I don't have to throw statistics at you guys. Our kiddos are much, much more at a higher rate to be victims of sexual assault or be accused of inappropriate sexual behavior. The stats are out there. You can look them up. It's huge. So we have to make sure that we're proactive about this and we're helping our students, even when our students have significant support needs, understand their private areas and the fact that no one has the right to touch them there without their permission. It's important, very important to do that as much as we can. And there are some resources listed later on in the presentation to help you navigate that process, no matter the support need of your student. And so always include your healthcare provider. They're the expert in all things body related, right? It's also great to show that relationship to your student, that unified front to your student about asking questions about their health. So if your daughter's struggling with her periods, maybe they're too heavy and they're hurting her, and she needs to know that it's okay to ask the doctor. One day you might not be there with her for her to know to ask the doctor. So it's important. Make sure that your healthcare provider speaks directly to your child. I hope that you've all found that out by in this journey this long, that they're treating your child like the patient and not you like the patient. Honor sensory preferences. So if they struggle with dim lights or too bright lights, my son's epileptologist meets him in the hallway because it's less overwhelming than the office spaces. He also makes sure that there's a timer in there and he doesn't wait more than 5 minutes in the room. So we have a great epileptologist, but respect those boundaries, of course. Okay. That your healthcare provider is following along with your plan, your parenting plan, and following your cultural guidelines as well. So in that social skills book that I put together, you'll see where you can insert actual pictures of your doctor into the healthcare team. Those can usually be found on any type of hospital website. So if you're like Springfield Clinic or HSHS, everybody's doctor has a picture on there, and you can insert those in there. Make sure that your child's on a first name basis, or a Dr. O or Dr. Miller with their doctors, and they know who their doctors are and what they provide care for. We have resources on our website for that too. We use the Charting the Life course framework, and they have a great printout for that, so you can find that within your resources. But it's great to make sure that you're talking about that, especially as our girls get a little bit older and need to start seeing the gynecologist. Okay, so that we create this safe relationship talking about bodies with our primary that transfers over easily to our gynecologist to talk about periods and reproductive care and sexual and being sexually active. So it's very important. Also, don't forget your doctor might be able to help with certain things like hygiene management. Like you're really struggling with XYZ, can you help with this? All of that is possibilities. So make sure you're having open conversations. Let's talk about hygiene support. Okay, hygiene supports. Oh, it's awful. It's so hard, right? My son has a lot of support needs, so we had to do a lot of this for him and show him how to do a lot of this. And the best advice I can give is to incorporate it into your daily routine twice a day, so that they get used to it. Use those visual schedules, use those social stories. As an adult, I shower every other day, but that's a really hard concept for my son to understand. He's better if we just black and white, you shower every day at 6 o'clock, so we do that. Okay. We make sure that when he showers, he uses the same routine. He washes his hair, washes his face, washes his body, like the whole, we have it down, guys. We don't change anything about it. Also, don't forget things like sensory aversion. Does your toothpaste taste a certain way? Does your deodorant smell a certain way? Sometimes my youngest son is also on the autism spectrum, and he will avoid a shower at all costs. You have to. It's awful. It's awful to try to get him in the shower. He's 17. Typically, he should want to take a shower, right? Well, we found out, the soap smelled funny. Okay. And he just did not verbalize that to us, that the soap was overwhelming for him. So think about these things, but teach hygiene before it becomes the issue. Build it into a daily routine and allow choice in products. So even when you're at Walmart, open the lid to the axe. Can you handle, like, it's pretty evident if they can't handle the smell. Research. Amazon is a great plethora of things. Put in there um, no smell deodorant, or dye free, whatever. Look into those things to see what could help your student. And don't forget about accommodations like a shower seat for stability, a long-headed scrubber for those limited reach spaces, a bidet for easier menstruation or toileting hygiene, adapted toothbrushes or toothpaste with easy grip handles. I always say, I think in about every presentation I do, if you have not had the chance to visit the Illinois Assisted Technology Program, please do so. Come to Springfield, spend the day eating some great food around there, seeing the Lincoln sites, and make sure you're visiting. They have a walkthrough of what they call their smart home, and you literally start at the front door and you just go around to all the rooms of the home. And in one of those rooms is the bathroom. And it shows you all the hygiene things that are out there that can help your students to overcome barriers that they may be facing. So make sure if you can't make it there, I absolutely understand, but do some research. You know, assisted technology with toileting, assisted technology with periods. These things are out there and can really help. Of course, there's tech for everything. Again, I want you to make sure you're looking into these apps before you just put it on your daughter's phone or your son's phone. But there's a lot there to help. We personally use the period tracker in our home to help my daughter prepare for when she's going to menstruate. Um, the Talk Puberty is also really great. I've not used the My Tenia app, but these are all educationally based apps that you can check out. They may be helpful for your students, but make sure you preview these apps first. I can't emphasize that enough. Again, for the sensory considerations, you might consider things being a neutral or unscented. Uh, Consider the texture of the pads or underwear that they wear if your student's already comfortable with using Depends because of incontinence. Maybe consider two Depends or a thicker Depend instead of introducing a pad or a tampon. Strong smells from deodorant or body spray may be overwhelming. The feeling of hair growth, we experienced this as a family. My son started picking significantly when he started to grow hair on his arms and legs, to the point that he had to take medication to stop skin picking because it was overstimulating for him. So you think, okay, we'll just shave the hair. Well, that made it worse because it grew back and it was itchy. So that was a fun little path there. Unfortunately, he got so overstimulated he would have a seizure, and so these are things to think about. And of course, cramps are horrible, and the sensation of menstruation might be a little overwhelming. You might see some behaviors in our students that can't vocalize that they're overwhelmed. So validate their experiences, okay? Don't come to them and say, I have a period every month and I make it through it. That's not helpful. Never force hygiene products. Problem solve together. If he says, I can't stand the smell of deodorant, think about what you could use instead of deodorant or an unscented option. If they come to you and say, I cannot shower, it's overwhelming to shower, can we wash up in the sink instead? Um, but compromise with our students. Sensory friendly puberty tools exist, and many can be adapted with input from an occupational therapist. So don't forget to consider that. Scooting back just a second to hygiene, it never hurts to add in our students' transition plan a hygiene goal. Okay, we use hygiene boxes and we leave one at school. We have one at home. It's a great time after PE to reinforce those hygienes. Wash your face, wash your underarms, change your clothes, put deodorant on. Okay, these are great things to add into that transition plan, as well as healthcare management and knowing who your doctors are. Following up on healthcare, don't forget our individuals struggle with equal access to healthcare. Teens with disabilities deserve that equal access, and that includes screenings and sexual health education. There is a lot of great sexual health education that is designed to help our individuals with disabilities out there. There will be some resources for it later on. You also, as a parent, can ask your school team what the curriculum is going to look like for health. Okay, all health curriculum is mandated during certain school years, and it's important to know what the curriculum is and how it's going to be presented to your student. If your student's going to go to a gen ed health class and color pictures all day, it's not helpful for your student to know what to do when someone wants to touch their penis. Okay, it is very important that the curriculum that we're presenting to these students that they can understand. So make sure that you ask for what's going to be presented, and if you're not happy with it, research on your own what you think would be helpful. We also have information on our website to help us navigate that process. But our students have the right to pap smears. Our individuals have the right to pap smears, STI testing, and reproductive education. Empower your teen to ask questions and participate in the conversations about their health. Disability is not a reason to delay or deny routine health care. So some additional resources, I think I've talked about them the whole presentation. I use this Amaze all the time. every day probably they have got a huge plethora of webs of they have a YouTube page and it has a video for everything you can think on them about there. Okay, so I teach social skills with Family Matters, and there's a video for everything on there. There's a video understanding different types of gender. There's a video on there understanding puberty, masturbation, you name it, it's on there. As with everything else, I would watch it before you show it to to your student, but it is a great resource, and they have a website and they have a YouTube channel, and it's great. It's wonderful. I highly recommend the Elevatus training course. I have taken several. I have some certifications in the Elevatus training, but it really shows you how to start the conversations, address behaviors, answer tough questions, and support healthy development with your students. So some of those are free, some of those have a cost to them. Some of them have a pretty long waiting list to sign up for them because they are highly wanted. But I urge you to take a look at their website. There's also Sex Positive Families, sexual health toolkits from PTAC, and of course, like I said, the Elevators training. You can actually follow this video, and it gets you to the workshop. So today, I'm going to ask you to please take our survey and let us know what you liked about the training. I did launch the poll earlier, so that those polls, I'm going to end those, and I will review those changes, those answers a little bit later. And the resources I send to you will be based on the polls. So this is a QR code in which you can take the survey. You will also get a prompt to take the survey as you exit the training. At this time, I'm going to stop the recording, and we're going to take some questions.